counting down 15 of the most advanced hospitals in the world. Starting with number 15, the Cleveland Clinic in Ohio. The Cleveland Clinic is widely regarded as one of the most technologically advanced hospitals in the world, particularly in the fields of cardiovascular care, surgery, and complex diagnostics. Founded in 1921, it's grown into a large integrated academic medical center with a main campus in Cleveland and a global network of affiliated hospitals and clinics. The hospital operates a highly integrated electronic health record system across the entire network, allowing clinicians to access patient data, imaging, lab results, and treatment histories in real time. This kind of integration supports coordinated care across specialties, which is important for patients with complex conditions. It was among the early adopters of high-resolution cardiac imaging, including advanced CT and MRI systems designed specifically for cardiovascular diagnostics. The hospital also uses hybrid operating rooms that combine surgery with real-time imaging, allowing the surgeons to perform minimally invasive procedures while continuously monitoring internal anatomy. These kinds of facilities are used extensively in cardiac, vascular, and neurosurgical cases. Speaking of surgery, Cleveland Clinic is known for its extensive use of robotic-assisted systems, particularly for cardiac, urologic, and gastrointestinal procedures. These robotic platforms are used to reduce the incision size and shorten recovery times. The hospital also operates a dedicated simulation center where surgeons and medical staff will train using realistic anatomical models and digital simulations. The clinic also operates one of the largest hospital-based research enterprises in the United States, with active programs in genomics, regenerative medicine, immunotherapy, and biomedical engineering. Its Lerner Research Institute supports translational research, meaning discoveries made in labs are designed to move efficiently into clinical trials and patient care when evidence supports their use. The hospital is also heavily invested in artificial intelligence and data analytics, particularly in radiology, pathology, and population health. AI tools here are used to assist clinicians in identifying patterns in imaging studies and predicting patient risk. Importantly, these tools are implemented as decision support systems rather than any replacement for clinical judgment, with oversight from physicians and researchers. The main campus, though, includes specialized institutes that are dedicated to heart and vascular care, cancer treatment, neurological disorders, and even digestive diseases. Each institute brings together multidisciplinary teams in purpose-built facilities designed around patient flow, the equipment access, and clinical collaboration. And while the Cleveland Clinic is frequently cited in global hospital rankings, its advanced status is grounded in measurable capabilities rather than reputation alone. Number 14, the Mayo Clinic in Minnesota. Mayo Clinic is one of the most advanced hospitals in the world, known for its integrated care model, its extensive research infrastructure, and early adoption of medical technologies that later become standard across healthcare systems. Founded in the late 19th century, the Mayo Clinic has evolved into a global medical institution with major campuses in Rochester, Minnesota, Phoenix, Arizona, and Jacksonville, Florida, with Rochester serving as its primary comprehensive site. Physicians across specialties will collaborate closely here, supported by shared digital systems that allow immediate access to patient records, diagnostic images, and test results. This kind of integration is enabled by a highly developed electronic health record system that supports complex case coordination and longitudinal patient monitoring. The Mayo Clinic has long been a leader in advanced diagnostic medicine. It operates one of the largest and most sophisticated clinical labs in the world, processing millions of tests annually. These labs support cutting-edge diagnostics in genomics, molecular pathology, and personalized medicine. Mayo Clinic was also among the early clinical adopters of whole genome sequencing as a diagnostic tool for rare and complex diseases. In imaging and procedural care, Mayo Clinic uses state-of-the-art MRIs, CT, and PET scans, and hybrid imaging systems, many of which are customized for specific clinical applications. They operate advanced interventional suites that combine the imaging, navigation, and allowing clinicians to diagnose and treat conditions with minimal invasiveness. Robotic-assisted surgery is widely used across multiple specialties, including orthopedics, oncology, and urology. The research institution here conducts thousands of active clinical trials, and it operates large research centers that are focused on cancer, regenerative medicine, immunology, and neuroscience. Mayo Clinic Center for Individualized Medicine integrates genetic data into clinical decision-making, allowing treatments to be tailored based on a patient's needs. They've also invested significantly in artificial intelligence and machine learning, particularly in radiology, cardiology, and predictive analytics. These tools are used to assist the clinicians in identifying disease earlier, stratifying patient risk, and optimizing treatment paths. And as with other advanced institutions, AI systems here at the Mayo Clinic are used under strict clinical governance frameworks to ensure transparency and patient safety. The Mayo Clinic's advanced status isn't defined by a single breakthrough here, but by its consistent ability to integrate technology, research, and clinical care into a unified system. Its long-standing focus on evidence-based innovation has made it one of the most technically advanced hospitals in the world. Number 13. Charite University Medicine in Berlin. Charite University Medicine in Berlin is one of Europe's most advanced hospitals, and it's one of the largest university hospitals in the world. Its origins date back to the early 18th century, and today it operates as a unified medical system across multiple campuses in Berlin. Charite is closely affiliated with Humboldt University and the Free University of Berlin, and its structure combines large-scale clinical care with intensive research and medical education. The hospital operates hundreds of specialized clinics and institutes, many of which focus on highly technical fields like molecular medicine, neuroscience, oncology, and infectious disease. Charite has been involved in the development and clinical application of diagnostics, including high-throughput genomic sequencing, precise oncology testing, and advanced immunological profiling used to guide treatment decisions in complex cases. Charite's imaging and diagnostic infrastructure is among the most sophisticated in Europe. The hospital operates high-field MRI systems, advanced CT scanners, PET-CT and PET-MRI platforms, and specialized imaging facilities dedicated to neurology and cardiovascular disease. Many of these systems are integrated into their clinical workflows that allow real-time image sharing across the departments, which enables rapid multidisciplinary consultation. This particularly is important for stroke care, trauma cases, and complex surgical planning. Hybrid operating rooms are combining imaging, navigation, and surgery capabilities in a single environment, allowing procedures that would previously have required multiple interventions. These facilities are used for experimental and first-in-human procedures, conducted under strict ethical and regulatory oversight. Charite has been internationally recognized for its work in infectious disease and public health. It's played a major role in diagnosis, treatment, and research of emerging infectious disease, supported by a high-level biosafety labs and specialized isolation units. Digitally, they've invested heavily in clinical data systems and medical informatics. Electronic health records, research databases, and imaging systems are all interconnected across its campuses. Charite's scale, its technical depth, and its integration of research and care make it one of the most advanced hospitals in the world. It's not defined by a single technology here, but by the breadth of high-level medical systems operating simultaneously within a unified academic framework. Number 12. Johns Hopkins Hospital, Baltimore, Maryland. Johns Hopkins Hospital is widely regarded as one of the most advanced hospitals in the world, particularly in academic medicine, research-driven care, and complex specialty treatment. Founded in 1889, it operates as the flagship hospital of Johns Hopkins Medicine, and it's closely integrated with the Johns Hopkins University School of Medicine. One of their defining characteristics is the deep integration of research into everyday clinical care. The hospital conducts extensive biomedical research across fields like oncology, neuroscience, cardiology, genetics, and immunology. Discoveries made in Hopkins laboratories are frequently translated into clinical trials and, when supported by evidence, incorporated into patient treatment. This kind of structure allows the hospital to adopt advanced therapies earlier than many non-academic institutions. Of course, it operates highly advanced diagnostics and imaging facilities. They've got high-resolution MRI and CT scanners, functioning neuroimaging systems, and advanced interventional radiology suites. Imaging data is tightly integrated into their clinical workflow, which allows surgeons, radiologists, and specialists to collaborate in real time. This is really critical for neurosurgery, stroke care, and complex trauma management, where time-sensitive decisions depend on precise imaging. In surgery, they make extensive use of minimally invasive and robotic-assisted techniques. Robotic platforms here are employed across urology, gynecology, general surgery, and thoracic surgery, improving their precision and reducing recovery times. The hospital is also known for its leadership in data-driven medicine. Johns Hopkins has invested heavily in clinical informatics, electronic health records, and advanced analytics to improve patient outcomes. AI tools are used in areas like radiology and pathology to assist clinicians in identifying abnormalities and prioritizing cases, always under physician supervision. Specialized care units at Johns Hopkins include advanced cancer centers, neurological intensive care units, transplant programs, and pediatric specialty. Many of these units treat patients referred from across the United States and internationally, often for conditions that cannot be managed elsewhere due to their complexity. Johns Hopkins Hospital's advanced status is rooted in its long-standing commitment to evidence-based medicine, technological innovation, and rigorous clinical standards. Number 11. Karolinska University Hospital, Stockholm, Sweden. Karolinska University Hospital is one of the most advanced in Europe. It's known for its strong integration of clinical care and biomedical research. It operates across two main campuses and is closely affiliated with the Karolinska Institute, one of the world's leading medical universities, and the institution responsible for selecting Nobel Prize laureates in physiology or medicine. A defining feature of the hospital is its emphasis on precision medicine. The hospital's invested heavily in genomic diagnostics, molecular pathology, and advanced biomarker testing, rare disease diagnosis, and complex inflammatory and neurological disorders. Genetic sequencing and molecular profiling are integrated into their clinical workflows when supported by evidence, which allows treatments to be tailored more precisely. The hospital is also highly advanced in surgical and interventional care. Karolinska uses robotic-assisted surgery across multiple specialties, including urology, gynecology, and gastrointestinal surgery. Hybrid operating rooms combine real-time imaging with surgery, allowing clinicians to perform minimally invasive procedures that previously required open surgery. These environments are particularly important for vascular, cardiac, and neurosurgical interventions. The hospital also uses integrated electronic health records and clinical data platforms that support patient care and large-scale research, and that allows clinicians to access imaging, lab results, and patient histories across the campuses. It's also involved in national and European initiatives that are focused on using health data for clinical research, of course under strict regulatory frameworks. It's a regional and national referral center for highly specialized care, and it provides advanced treatment for severe trauma, complex cancers, organ transplantation, and rare diseases. Many patients treated here are referred from other hospitals in Sweden or from neighboring countries where local facilities lack the required expertise. Its advanced status isn't defined by its size alone, but by how deeply research, technology, and clinical care are integrated. It's a model in which innovation is systematically translated into patient care, and it makes it one of the most sophisticated hospitals in the world. Number 10. The Samsung Medical Center in Seoul, South Korea. The Samsung Medical Center is widely recognized as an advanced hospital. It's one of the most advanced in Asia, particularly in digital healthcare and advanced diagnostics. It opened in 1994, and it's affiliated with the Sungkyunkwan University of Medicine. The hospital was designed from the outset to integrate cutting-edge tech into everyday clinical practice. One of its strengths is its digital infrastructure. The hospital operates a highly advanced electronic medical record system that integrates with clinical notes, imaging, laboratory data, and real-time patient monitoring. They've implemented automated medication dispensing, logistics systems, and even centralized monitoring centers to improve safety and efficiency. It operates a large number of high-end MRI and CT scanners, PET-CT systems, and specialized imaging equipment for oncology and cardiology, and they are heavily used in early disease detection and treatment planning. In surgical care, the center makes extensive use of minimally invasive and robotic-assisted techniques. Robotic systems are used across urology, gynecology, general surgery, and even thoracic surgery. They operate a hybrid operating room that combines imaging and surgery to allow complex procedures to be performed with greater precision and reduced recovery times. It also conducts a large number of clinical trials, and it collaborates with academic and industry partners on the development of new therapies and medical devices. Research programs focus on cancer, cardiovascular disease, neuroscience, and transplant medicine, with an emphasis on translating research findings into clinical practice. It was one of the first hospitals in South Korea to redesign facilities and workflows following major infectious disease outbreaks, which incorporate negative pressure isolation rooms, advanced ventilation systems, and centralized infection monitoring. Their advanced status is rooted in its system-wide use of technology rather than a single breakthrough. The combination of digital integration, the diagnostics, and the procedural care make it one of the most sophisticated hospitals currently in operation. Number 9. Singapore General Hospital. The Singapore General Hospital is one of the most advanced in Asia, and it's a pillar of Singapore's public healthcare system. Established in 1821, it is the country's oldest hospital, but its age does not define it. It's undergone continuous modernization and now operates as a large tertiary and quaternary referral center. It's closely integrated with the Duke Medical School and Singapore's national research infrastructure. Its advanced status is its role as a national referral hospital for complex acuity care. It provides specialized services in oncology, cardiology, neurology, trauma, transplantation, and infectious disease. Many patients treated here are referred to from other hospitals within Singapore or from neighboring countries. They've got advanced diagnostic and imaging facilities too, high-field MRI systems, advanced CT scanners, PET-CT imaging, and specialized cardiovascular neuroimaging units. This imaging data is fully integrated into their electronic medical system, which allows the clinicians across departments to access results instantly. This, of course, supports rapid decision-making, particularly in time-critical cases like a stroke, trauma, or acute cardiac events. In surgical and interventional care, they make widespread use of minimally invasive and robotic-assisted technology. It also has a hybrid operating theater that combines real-time imaging with surgery, enabling a complex vascular, cardiac, and oncological procedures that can be performed with fewer interventions. It has numerous clinical trials here, collaborates with national research agencies and studies on cancer and infectious disease. It's played a significant role in translational research, ensuring that validated discoveries moves efficiently from laboratories into the clinical practice. Its infectious disease expertise in particular has been critical in managing outbreaks under controlled and highly monitored conditions. They used advanced analytics and decision support tools to improve care quality, with physician oversight and, of course, strict regulatory governance. Specialized centers are housed within the campus to centralize expertise, equipment, and staff, and that reduces delays, improves coordination, and allows patients to receive comprehensive care within a single system. Singapore General Hospital's standing as one of the world's most advanced hospitals is based on scale, technical depth, and its system-wide integration. Its strong research alignment places it among the most sophisticated healthcare institutions in the world. Number 8. The Sheba Medical Center, Israel. The Sheba Medical Center, also known as Tel HaShomer Hospital, is widely regarded as one of the most advanced hospitals in the Middle East. Located near Tel Aviv, Sheba is Israel's largest hospital and a major national referral center, providing advanced care across nearly every medical specialty. The hospital has invested extensively in advanced electronic health records, real-time patient monitoring, and clinical decision support platforms. These kinds of systems allow the clinicians to track patient data continuously and coordinate care across departments. Sheba operates numerous research institutes that are focused on oncology, immunology, and regenerative medicine, along with neuroscience and digital health tech. Many of these programs work closely with Israel's technology sector, which results in the development of clinical testing of new medical devices. In diagnostics and imaging, they operate high-end MRI, CT, and the PET-CT, and specialized imaging platforms used in oncology, cardiology, and neurology. The imaging data that's produced is fully integrated into hospital-wide systems, enabling multidisciplinary teams to collaborate on complex cases. Surgical care at Sheba includes extensive use of minimally invasive and robotic-assisted techniques. The hospital also operates an advanced hybrid operating room that combines imaging, navigation, and surgical technology, all allowing complex interventions to be performed with greater precision and fewer complications. They operate specialized facilities designed to maintain full hospital function during mass casualty events or regional emergencies, and those systems are supported by redundant power and ventilation systems and rapid patient triage technology. Their medical center's reputation is grounded in its measured capabilities rather than any branding. Its sustained investment in technology, research, and clinical systems makes it one of the most advanced operating anywhere. Moving on to number 7, the University of Tokyo Hospital. The University of Tokyo Hospital serves as Japan's leading academic hospital and a central hub for high-level clinical care, biomedical research, and medical education. Founded in the mid-19th century, it operates as the primary teaching hospital of the University of Tokyo Facility of Medicine and plays a major role in shaping national healthcare standards. The hospital treats a high volume of complex and rare cases referred from across Japan, many of which required specialized diagnostics conducted under strict regulatory oversight. Its close relationship with Japan's top medical researchers allow validated discoveries to move more efficiently from laboratory settings into clinical trials and approved treatments. The hospital operates highly advanced diagnostic and imaging infrastructure. This includes high-field MRI systems, state-of-the-art CT scanners, and PET-CT imaging, and specialized diagnostic platforms for oncology, neurology, and cardiovascular disease. The imaging data is tightly integrated into hospital-wide digital systems, which allows specialists across departments to access and interpret the results simultaneously. In surgical care, it uses advanced minimally invasive and robotic-assisted techniques across multiple specialties. Hybrid operating rooms combine imaging, navigation, and surgery, which allows clinicians to perform procedures that previously required open surgery. The hospital is also a national leader in precision medicine. Genomic testing, molecular diagnostics, and biomarker analysis are all integrated into treatment planning for cancer, inherited disorders, and rare diseases when supported by evidence. They've been involved in the development of Japan's clinical genomics infrastructure, and they play a key role in defining how genetic data is responsibly used in patient care. Digitally, advanced analytics are used to support clinical decision-making, quality control, and hospital operations. Artificial intelligence tools are actively studied and deployed in areas like radiology and pathology, with strict physician oversight and regulatory compliance. The hospital's advanced status also reflects its role as a national referral center for transplant medicine, complex oncology, and advanced cardiovascular care. Many procedures performed at the University of Tokyo Hospital are unavailable at smaller regional institutions. The hospital's position among the world's most advanced hospitals is grounded in its depth of technical ability, its research integration, and national leadership. Its strength lies not in its isolated environments, but in the systematic way advanced medicine is developed, validated, and delivered at scale here. Number 6. Toronto General Hospital. Toronto General Hospital in Canada is one of the most advanced in North America, and it's a global leader in complex surgical care. It's part of the University Health Network, the UHN, Canada's largest academic healthcare organization. Its advanced status is rooted in decades of sustained innovation and high-acuity clinical care. It's internationally recognized for its leadership in cardiovascular treatment. It houses one of the world's most advanced heart programs, including complex cardiac surgery, mechanical circulatory support, and heart transplantation. They've also been a pioneer in the use of ventricular assist devices and other advanced heart failure technologies, many of which were introduced through rigorously controlled clinical research programs. In surgical care, Toronto General Hospital makes extensive use of minimally invasive and robotic-assisted techniques. They're employed in thoracic surgery, general surgery, which all improve precision and recovery times, and hybrid operating rooms allow surgeons to combine imaging and intervention within a single environment, and that's great for complex vascular and cardiac procedures. Research is also deeply embedded in the hospital's operations. It's closely linked with research institutes, which conduct extensive work in regenerative medicine, stem cell research, immunotherapy, and biomedical engineering. They regularly conduct clinical trials that evaluate new therapies, devices, and treatment protocols before they're adopted into standard care. Digitally, the hospital uses advanced electronic health records and clinical data platforms that support patient monitoring, quality improvement, and population health analysis. And as a national and international referral center, Toronto General Hospital treats patients from across Canada and abroad. Its combination of advanced tech, research intensity, and clinical scale places it among the most technically sophisticated hospitals operating today. Number 5. The Massachusetts General Hospital. Massachusetts General Hospital is one of the most advanced in the world. It's recognized for its integration of clinical care, biomedical research, and medical education. It was founded in 1811. It's the original teaching hospital of Harvard Medical School, and it serves as a major referral center for complex and high-acuity cases. They operate one of the largest hospital-based research programs globally, anchored by the Mass General Research Institute. Thousands of researchers, clinicians, they all collaborate across fields like cancer biology, neuroscience, cardiology, immunology, and genetics. This kind of structure allows discoveries made in labs to move into clinical trials and, when supported by evidence, into routine patient care. The hospital conducts a large number of active clinical trials at any given time, many focused on first-in-human or early-phase therapies, and diagnostic and imaging capabilities here are among the most advanced in clinical medicine. They operate high-field MRIs, advanced CT scanners, PET-CT platforms, and specialized imaging units. The researchers here have also played a leading role in developing functional MRI and other advanced imaging techniques that are now widely used in hospitals around the world. In surgery and interventional care, they use minimally invasive and robotic-assisted tech. Hybrid operating rooms are combining real-time imaging with surgery, allowing complex vascular and cardiac procedures to be performed. They're also a leader in digital medicine. Its electronic health records system integrates patient data, imaging, laboratory results, and clinical notes across departments. And they are using artificial intelligence tools that are studied and deployed in areas like radiology and pathology, only after validation, of course. They treat patients with conditions that can't be managed at smaller institutions, including complex cancers, neurological disorders, and advanced cardiovascular disease. Massachusetts General Hospital's global standing reflects its consistent ability to combine technology and patient care into a highly sophisticated medical system. Number 4. Peking Union Medical College Hospital, Beijing. Peking Union Medical College Hospital is one of the most advanced in China, and it serves as a national center for complex diagnosis. Founded in 1921, the hospital operates under the Chinese Academy of Medical Sciences and is closely affiliated with Peking Union Medical College. It serves as a national referral center for rare diseases, autoimmune disorders, and difficult-to-diagnose conditions. Patients are often referred here after extensive evaluation elsewhere when diagnoses remain unclear. Their diagnostic capability is supported by advanced lab medicine, molecular diagnostics, and specialized clinical expertise that's developed over decades. Of course, they have highly advanced imaging, including high-resolution MRI, CT, PET-CT, and specialized imaging systems for cardiovascular and neurological disease. In surgical and interventional care, they used advanced minimally invasive and robotic-assisted techniques across multiple specialties. This includes general surgery, gynecology, orthopedics, and urology. Their hybrid operating rooms allow for complex procedures that combine imaging and intervention, particularly for vascular and oncologic cases. The hospital is also a major center for clinical research and medical education. Research focuses on immunology, endocrinology, oncology, and rare disease mechanisms. Findings from these programs are incorporated into clinical practice only after regulatory review and confirmation of safety and effectiveness. Digitally, the hospital is invested heavily in integrated electronic medical record systems, clinical data platforms, and hospital-wide information systems. They are essential given the hospital's high patient volume and national referral role. Their ability to manage some of the most complex medical cases in the country places it firmly among the world's most advanced hospitals. Number 3. Hospital Israelita Albert Einstein, São Paulo, Brazil. That's a name, Hospital Israelita Albert Einstein. It's widely recognized as one of the most advanced in Latin America. It was founded in 1955 in São Paulo. This hospital operates as a private, nonprofit academic medical center, and it serves as a national and international referral destination for complex and high-acuity care. One defining feature here is the advanced digital and data infrastructure. They operate fully integrated electronic health record systems that connect clinical notes, imaging, laboratory results, and real-time patient monitoring. This all supports rapid clinical decision-making and coordinated care, particularly in intensive care, oncology, and complex surgical cases. The hospital is internationally accredited and has consistently met high-level performance benchmarks for patient safety and clinical outcomes. The intensive care units are among the most advanced in the region, using continuous monitoring systems, advanced ventilation support, and protocol-driven care pathways. Imaging data here is seamlessly integrated into clinical workflows, allowing multidisciplinary teams to review cases simultaneously. This is important for cancer staging and neurological disorders and surgical planning. They do have extensive use of minimally invasive and robotic-assisted techniques. The robotic platforms are used across urology, gynecology, general surgery, and digestive surgery, improving their recovery times when clinically appropriate. Hybrid operating rooms also allow image-guided procedures to be performed in real time, which supports advanced cardiac and oncologic interventions. Research and education here are central to their mission. It operates a major research institute that conducts clinical trials and applied medical research in areas like oncology, cardiology, and infectious disease. They're also known for their leadership in healthcare innovation. It's developed and tested artificial intelligence tools for image analysis, patient risk stratification, and operational optimization, all under regulatory oversight. Their advanced status shows the ability to deliver highly complex care while also maintaining strong governance and technological depth. Their capabilities place it among the most advanced hospitals not only in the Southern Hemisphere, but in the world. Number 2. Ronald Reagan Medical Center in Los Angeles. Ronald Reagan UCLA Medical Center is one of the most advanced hospitals in the U.S. and a flagship institution within the University of California, Los Angeles health system. Opened in 2008, the hospital was purpose-built to support highly complex medical care, advanced research, and large-scale emergency readiness. At the heart of the hospital is its highly advanced infrastructure. The hospital was designed to remain fully operational during major disasters, including earthquakes, with reinforced structural systems, redundant power, and advanced ventilation and water systems. This will allow uninterrupted care during an emergency, while also supporting complex daily operations. They do have some of the most advanced diagnostic and imaging facilities in the region: high-field MRI scanners, advanced CT systems, PET-CT imaging, and specialized platforms for neurological and cardiovascular diagnostics. The imaging data is fully integrated into their electronic medical record systems. It's also internationally recognized for its transplant programs, including kidney, liver, heart, and lung transplantation. These programs rely on advanced surgical techniques, precision diagnostics, and post-transplant monitoring. The surgical services here at the hospital make extensive use of minimally invasive technology. Robot systems are used across urology, gynecology, general surgery, and head and neck surgery. And of course, the hospital's closely integrated with UCLA's extensive research ecosystem. It participates in a large number of clinical trials across oncology, immunology, and regenerative medicine. Many advanced therapies offered at the hospital are delivered within regulated clinical trial frameworks. Their artificial intelligence tools are being studied and selectively deployed in areas like radiology and pathology under strict clinical governance, and their advanced status is defined by its purpose-built design, technical capabilities, and integration of research with clinical care. Their ability to manage some of the most complex medical cases in the world places it firmly among the most advanced hospitals currently in operation. Number 1. New York Presbyterian Hospital. New York Presbyterian is widely regarded as one of the most advanced hospitals in the world, combining clinical capacity with cutting-edge medical technology. It operates as a major academic medical system affiliated with both Columbia University and Cornell Medicine. This dual academic partnership is unusual, and it gives the hospital access to one of the largest concentrations of medical expertise anywhere. This hospital functions as a referral center, meaning it routinely treats patients with conditions too complex for most other hospitals. These include advanced cancers, rare genetic disorders, complex neurological diseases, and severe cardiovascular conditions. One of New York Presbyterian's defining strengths is its advanced diagnostic and imaging. The hospital operates high-field MRI, advanced CT scanners, PET-CT imaging, and specialized platforms for neurological, cardiovascular, and oncologic diagnostics. This kind of capability is essential for time-critical care like stroke treatment, trauma management, and even complex surgery. In surgery, New York Presbyterian makes extensive use of minimally invasive technology. Robotic systems are used across urology, general surgery, and gynecology, plus thoracic surgery and colorectal surgery. The hospital is also a global leader in transplant medicine. It operates highly advanced programs for heart, lung, kidney, liver, and multi-organ transplant. These programs rely on precision diagnostics and intensive post-transplant monitoring, supported by advanced immunology and infectious disease expertise. Research is also deeply embedded in their clinical operations. The hospital conducts a large number of clinical trials across oncology, neurology, and cardiology. Many advanced therapies offered at the hospital are delivered within regulated clinical trial frameworks, ensuring that new treatments are introduced only when supported by regulatory approval. Digitally, they operate one of the most advanced informatic environments. Electronic health records, imaging systems, lab data, and real-time patient monitoring are fully integrated across the hospital campus. Artificial intelligence tools are being used selectively in areas like radiology and pathology, but only after validation that they actually work. Their entire physical infrastructure is also designed to support high-acuity care at scale. Specialized centers for cancer, cardiovascular disease, and pediatrics are housed in purpose-built facilities. The New York Presbyterian Hospital's position at the top of this list reflects not just a single breakthrough, but the sustained ability to deliver the most complex medical care using advanced technology, integrated research, and large-scale systems. Its scope and technical sophistication place it among the most advanced hospitals operating anywhere in the world today.